I was like, wow, this is the greatest thing I've ever seen. This is unbelievable. I've been doing this for many, many years, and I've never seen a product like this.
This system literally takes seconds to come down and seconds to put back up.
It's easy flowing, it's nice, easy to put up, easy to take down.
All the nursing units want it. I think they were totally amazed. They couldn't believe the ease of it and the time that it would save for the environmental staff.
The old curtains they're a nightmare, truly.
If you've ever been in a facility and seen the old ball and chain type of curtain tracks, they are extremely noisy. They're difficult to pull. Sometimes they get tangled up. The hooks break off.
The rollers would get hung up. They were plastic sometimes. They would break.
We have had many housekeeping personnel and nursing personnel have injuries, either trying to pull the curtains or trying to remove the curtains.
It would take much longer than it would with this new on the right track system.
Your product is super quiet, doesn't make any noise when you're sliding them around the tracks.
That when these curtains open up with on the right track, there's no sound. The old system, clang, bang. I think people in general, when they hear the sound of a curtain opening up, am I going to get a needle? Am I going to get stuck? Am I going to get, something not good is going to happen. So the least we can do to make a patient, the more we can do, I should say, to make a patient feel comfortable, we want to do. And by using this product, I think it's going to help.
Hospital infections is a very hot topic. Everything that we strive for is to eliminate infection.
Hospital infections kill more people in the United States each year than all the cases of AIDS, plus all the cases of breast cancer, plus all the car accidents combined, well over 100,000 deaths a year. It's the fourth largest cause of death in the United States. And in fact, hospital infection is the next asbestos, the next major cause of class action lawsuits. And hospital board members should be very concerned about this, as well as hospital staff members and contributors. New technologies are our most important ally in helping to prevent hospital infections, and they range from the very simple to the very complex. Simple, new types of curtains. Curtains and bed rails are the #1 vectors of infection-causing bacteria in a patient's room. Anything that can be done to reduce the risks posed by privacy curtains to patients is a real game changer in the hospital and nursing home community as well.
As isolation cases come up and things like MRSA and C. diff and VRE become more prevalent, as we are seeing, we do the whole room and every curtain comes down and everything gets washed down in the room, totally, regardless of what type of isolation case it is. When you add up all the labor time of 10 isolation discharges a day times 40 minutes and the washing time, it's extremely labor intensive. On the right track, it is absolutely a money saver in the long run, and it saves a lot of labor.
The time that it takes an environmental staff to hang it is calculated in the long run.
I added up the time it took to do the on the right track system labor-wise and compared it to the cost, and the savings will be realized in a matter of months. And the labor savings were phenomenal. It was somewhere around $20,000, $25,000, $30,000, more than justifying the extra cost for the on the right track system.
As long as I'm here, I'm going to make sure that they're going to install this product.
It's definitely a good looking product, and the ease of use and everything, it's a no-brainer.
Come here. You can see what we have and how we're using it. I think if you see it, if you touch it, if you play with it, you'll fall in love with it.